Welcome back. This is Prepare Now. My name's John, and we're going over the meat and potatoes of our first aid kit. Now, you're going to see more or less in most first aid kits of these supplies. These are mainly used for wound care. Nothing of this stuff that I've shown before, nothing I've added, all been the same. Basically, when you have a wound, it comes in multiple shapes and sizes, and you've got to figure out exactly what you need to use. You're not going to put this on a paper clip, and you're not going to put this on something you just hit your leg with an axe. Ain't going to work. Sorry, nice try. You can throw 1,000 band-aids on it, it's not going to work. So, let's say we have a normal cut. Let's say you are out in the wild using a normal knife, and you cut your finger because you're cooking up whatever kind of food you were, whether it's prepared or fish or whatever. So the biggest thing you want to do, either your hands are really clean, and there's areas you can use soap and water and wash, which is highly unlikely. 2, I'm talking about, the hands that you're going to be preparing it, or you need to just put something on. So if this is hands is that one that's injured, they provide some nitrile gloves, which is nice because you can put those on automatically. You have a clean hand to work with. Now, always treating yourself is a much bigger pain in the butt than it is treating someone else. Trust me from the experience as a paramedic for almost 20 years. I've treated myself many times, and it's all much bigger pain in the butt than and treat someone else separately. So if you can explain how to use these items to a person with you, it'll be 10 times easier, and it's not that hard. So if let's say I cut my finger, it's a nice pretty good cut across my finger. First of all, I want to clean the area. So you have alcohol and you have antiseptic wipes. This one has a different kind of antiseptic than just pure isopropyl alcohol. Both will work. This is more just cleanse your hands, get the area clean. This is actually a more of a skin prep area. So the best thing to do is, honestly, if you have a canteen of water, I want you to rinse out the area debris, get anything that's stuck in there. That's where this lovely syringe comes in with this lovely tip. That's a hole not made at all to stab yourself with, but to flush out wounds. So you would use that with some nice clean purified water and irrigate that as much as you can. Next, I would use the alcohol. This is not going to feel good, but I would just rub, as long as it's not big and gaping, you just have a nice clean cut, is just clean the area. It's going to sting. If you scream, you're going to wake up the wildlife. You're going to hear, dogs and deer, they're all going to get pissed off at you. So next, you're going to figure out how big a cut it is. And for this cut, you could get away with using something like this, which is basically a 2x2. With a little antiseptic, which it comes in this kit right here. So now we've cleansed it. The biggest thing now is it gaping, or is it a clean little cut? Either way, you can do 2 things. You can go ahead and use steri strips and close it, which I'd probably do if your hands are pretty clean. Now, if it's a jagged cut or something like that, it's going to be a lot harder to do. Steri strips are basically pre-cut pieces of tape. And what you do is you stick down one side and you anchor. So you apply it one side and then pull and then stick down the other. That should bring a pinch point. You can go ahead and then put the antibiotic on top, and then you go ahead and put a 2x2. Bandages are really not made for this, even though it sounds like a great opportunity. The problem is when you're outside, you want to be able to take them off easy, and these things love to grab dirt and all kinds of things. These are perfect for like little small things. I call them boo-boo kits. So we're going to throw that out. Let's say you are on blood thinners, or you've had a couple too many libations tonight, you're going to be bleeding a lot more. So you need a whole different kind of thing. Sometimes people are going to bleed and bleed and bleed, and that's going to go into another episode called Stop the Bleed, where I'll go into how to use the difference between different gauzes here, rolled gauze, sterile electric gauze, elastic gauze, tourniquets, and all that stuff. But the biggest thing is we want to keep the area clean. So let's say you're not on blood thinners, you've not been having the tons of drinks tonight, and you're just kind of oozing a little bit. You put this on, use this rolled gauze, and to put nice firm pressure. Not at the point that you can't feel your finger, but you can actually cut this and when you're done and save the rest. Doesn't mean you have to use this whole thing. You can put it back in these lovely sacks they give you, or put Ziploc bags in your first aid kit, and so you can keep your stuff clean when you're hiking. Once you do that, you go ahead and periodically replace the bandage and Neosporin if the outside gets dirty, and as soon as you get out, go ahead and seek medical attention just to make sure that doesn't get infected. You might need a tetanus shot or whatnot, but this will definitely get you out of the woods to get you to a higher level of first aid and medical care.